Hello everyone, welcome to our channel. This is Kajal. First and foremost, I would like to mention that all our content is for educational and entertainment purpose only. Please seek medical advice or see a licensed professional for personal individualized care. Our aim is to support you in your journey towards a better mental health and personal development. Today, we would be talking about PTSD, post-traumatic stress disorder. So PTSD is a mental and behavioral disorder that develops from experiencing a traumatic event, which could be anything such as sexual assault, warfare, collisions, domestic violence, threats on personal well-being, etc. Symptoms may include disturbing thoughts, feelings, or dreams related to the events, mental or physical distress to trauma-related cues, attempts to avoid trauma-related cues, and alteration in the way a person thinks, and there is always an increase in fight or flight response. And the symptoms for PTSD basically could last for more than a month after the event actually taking place. So some people with PTSD, they are at high risk for suicide and intentional self-harm. You may have heard terms such as schema, trauma, schema therapy, and CBT, cognitive behavioral therapy. So let's talk about each of these in a little bit more detail so we know exactly what we are dealing with. Because sometimes when we go to our therapist and they may be using these terms and you really don't know what exactly is going on. So let's just talk about them in a little bit more detail. So schema versus trauma. Schema basically is a pattern of thoughts or behavior that organizes categories of information and relationships among them. To put simply, it can be described as a mental structure of preconceived ideas, a framework representing some aspects of the world, or its system of organizing and perceiving new information. Example of schema can be stereotypes, social schemas, social roles, scripts, and worldviews, archetypes. For example, children construct a series of schema based on the interactions they experience to help them understand the world. Now, schema therapy. Schema therapy helps overcome persistent life patterns. How you perceive and interpret a situation are called schemas. For example, maybe you are mistrustful or you're feeling inferior. Your schema can make you feel and think in unrealistic ways. Schema therapy helps you recognize the schemas and approach things differently. You can break old patterns and get more out of life. Trauma, on the other hand, it is a particular event that any individual has experienced and gone through. Now, let's deep dive into PTSD and trauma-focused CBT. Memories related to the trauma could be devastating. Usually, people with PTSD, they try to ignore and avoid the trauma, and they try to run away from these memories rather than dealing with it because it's hard. And here is where trauma-focused CBT comes in handy. To understand this easily, let's look at a scenario. Imagine a wardrobe where you have everything organized really well. Everything is well arranged and you can take out any cloth at any time that you want, any shoe that you want. And you can also put them back away in its place anytime that you feel. How would that feel? Well, right? Because it's all organized. It's easy. It's convenient. Now, this is what happens when you recall good memories. So our mind lets us know how good we felt during those days at that moment. And you control recalling these memories very well because you're happy to remember those memories. So basically, It's like a switch that you know how to regulate. On the contrary, when it comes to the bad memories, the memories from any trauma that we have experienced, it is a kind of a situation. Imagine again, we'll take the same example, but now that wardrobe is a messy wardrobe. Whenever you would open the wardrobe, the clothes, they would just fall out. You cannot figure out where that favorite pair of your pants are. So you give up. You're like, I don't want to really deal with this. And you certainly do not like that feeling. You feel distressed in that moment. Now, similarly, trauma-related memories are just like that. We fail to regulate our emotions. Our responses to those memories is to basically never recall these memories. We tend to avoid how to deal with them, and we might not even know how to deal with them. And the same cycle goes on and on and on and on until we try to figure out a solution to regulate these emotions, right? Now, this is where trauma-focused cognitive behavioral therapy comes in handy, which is conducted by a registered therapist, and it is the best way to get started. There are many other things that we can do, but CBT is the best. Now, I would like to share a personal experience of mine where I myself went to therapy for something related. In one of my past relationships, I was a victim of domestic violence. When I was experiencing that violence, in that particular moment, when it was all taking place, I completely froze. I did not know how to respond, what to do in that very minute. Many people would say, oh, you should have just called the police, you should have done this, you should have reported. But trust me, it's hard when you are actually experiencing it from somebody that you trusted your life with. So I basically started avoiding it. I ignored thinking about it, and few days after that event, I initially became numb to my emotions, but whichever emotion you call it. And probably 2 to 3 months down the line, after that event occurring, I had exaggerated response to anything that reminded me of that moment. I could not regulate my emotions when anything related would happen. I was always hyper aroused. I was hyper vigilant. And my fear, my worries, they kept on increasing day by day. The reason was I was not dealing with those emotions in the right manner. When I thought about sharing this with somebody, I was feeling ashamed. I was scared to be judged. I was scared to be labeled as weak. But then I decided to talk to my therapist. And it was not even the first 2 or 3 sessions that I felt comfortable enough to talk about that particular trauma. It was probably 4th session that I started opening up to her, and I told her how everything went down and whatever happened during that traumatic event. My therapist then tried to explain to me that, first of all, that trauma that I experienced was definitely not my fault. Whatever happened that day and whatever the other person did to me, it cannot be justified in any word. Then my therapist asked me to tell her the whole story of how the whole trauma went down. And in my consecutive visits with her, she helped me regulate my emotions and deal with the feelings and memories that I felt about that particular event or trauma. So something my therapist told me, and that really resonated with me a lot, is that these memories, they belong in the past. and we have to keep them in the past. And we should have control over when we want to recall these memories and our responses towards those trauma related memories. Going through these sessions with your therapist, I totally understand that that could be very challenging. But I can tell you, the moment you let it all out, and that someone can assure you that you are allowed to feel those feelings that you're feeling. And there are always better ways to regulate these emotions. And once you know how to regulate these emotions and feelings, you would definitely get the freedom and you will never be feeling trapped again.